Okay, so first of all, talking about here, this is the third part of the pathology lecture, everything you need to know, starting out with different fates of thrombi. A thrombus can end in propagation, embolization, lysis or dissolution, or organization, recanalization. In the case of propagation, what you think of this is almost like the snowball effect, that these small thrombi, or the thrombi, is just getting bigger and bigger and bigger and bigger with all the platelet effects and stuff going into it. Embolization is the case where essentially it breaks free and it's going to travel through the blood, the circulation. Lysis and dissolution is where the clot gets broken down until it disappears. Organization and recanalization is where the clot will adhere to the wall and kind of become incorporated into the wall. It seems like this is sort of what's going on with like the lines of Zahn, but I'm not sure. Recanalization is where the clot was maybe obstructing it, but there ends up being like holes going through it or something. So it's almost like a little canal going through the middle. In the study guide, it was saying that you also need to understand different types of thrombi. One that wasn't mentioned was the mural thrombi. Mural thrombi are found in the heart. They are a type of like arterial thrombi. Next part is we need to know the different infarcts. There are three types of infarcts mentioned here. There is red, white, and cystic infarcts. A red infarct, the main thing we need to know is the reason why it's red is because it has a dual or extensive collateral circulation, which means that there's blood coming in from multiple ways. So although one part may be blocked off, the other blood supply is allowing blood to flow into there, and so the tissue still dies because it's not getting enough oxygen, but blood is coming into the area which makes it red. You also need to understand that red infarcts have venous or arterial, they could be venous or arterial rather. So this is essentially when there's bleeding into the necrotic area. It's usually going to be in the brain because there's lots of dual blood supply in the brain, or in the small intestine, which also has lots of dual blood supply. And I think it also happens in the testes, if I remember it correctly. Maybe not. This involves coagulative necrosis, same as white. I think all white also has coagulative necrosis, but it says that the white's coagulative necrosis is uniform, so I don't know what that means, but it says that what happens is that the debris, essentially when this clot happens, that I guess there's still blood getting there, so still macrophages and everything, so the debris gets digested and then it forms a scar in that area where the red clot was. Okay, now for a white clot. So a white clot is when something has a single blood supply. Organs that it mentioned were the kidney, the heart, and the spleen. So in this case, this is where it's just arterial. The other one was, red was arterial or venous, white is just arterial. It creates a wedge-shaped infarct. So you'll see like the organ like this, and then there'll be this area where like the occlusion is here. So all the stuff that is occluded is everything that branches off from that. And so the infarct will have this wedge shape like that. And apparently under microscopic evaluation or examination, whatever, it has uniform coagulative necrosis. Lastly, cystic infarcts are ones that occur in the brain, and they undergo liquefactive necrosis. So these two were coagulative, cystic is liquefactive necrosis. Okay, now moving on to shock. There are a number of different types of shock. Shock can be compensated or decompensated. Compensated shock is essentially when your body can compensate for it and you can come out of it and you don't die. Uncompensated shock is when your body can't compensate for it and you die. So different types of shock are cardiogenic, hypovolemic, and then they have systemic vasodilation, septic, anaphylactic, or neurogenic. I'll explain this in a second, but first explaining, I missed over what happens when a person gets shock. So essentially when a person goes into shock, it's because their cardiac output decreased, or their blood volume decreased, or which kind of leads to the decreased tissue perfusion, and ultimately can lead to ischemia. So it's basically like blood's not able to get everywhere in the body, and the person goes into shock. So starting out here, cardiogenic shock. This is also sometimes called obstructive shock. I'm not exactly sure why, but sometimes this is associated with myocardial infarctions, pulmonary embolisms, and cardiac tamponade. Cardiac tamponade is where there ends up being fluid or blood around the heart in the pericardial recess, or what, I can't remember what that's called. Then there's hypovolemic shock. Hypovolemic shock is just what it sounds like. You got a hemorrhage, or you got super dehydrated. Maybe you had really bad diarrhea, or maybe you got burned really bad. And you weren't able to, get enough fluids, and so you don't have enough blood volume. Obviously, you're not going to be able to get blood to all parts of your body. Next, systemic vasodilation. This is also pretty straightforward. You may have enough blood in you, but if your blood vessels are so expanded that you don't have enough blood pressure to push the blood all the places it needs to go, you might as well have had not enough blood, so you're going to go into shock because you're getting not enough tissue perfusion. Next is septic shock. So septic shock is, you think of this when you think of a person getting a gram-negative bacterial infection. And this is associated with Waterhouse-Friderichsen syndrome, where somehow the person ends up getting septicemia, which leads to adrenal insufficiency and enlargement and meningitis, apparently, sometimes with that. So think of adrenal with Waterhouse-Friderichsen. Often this has a procoagulant aspect to it as well, so your blood starts to coagulate because of all the bacteria in your blood. And also, I already got that. Next is anaphylactic. So anaphylaxis is when your blood vessels expand. Is that correct? Yeah. Your blood vessels are expanding, so you get increase. I don't know what VP stands for. Crap. So you also have. It says it's mediated by IgE. And lastly, neurogenic shock, which is basically where your control center has shut down, which is controlling what is happening in your body with vasodilation, all that stuff like that. So the consequences of shock has here, there's sometimes you can get shock lung, which is essentially leads to acute respiratory distress syndrome, or you can get acute tubular necrosis, which is a problem with your kidneys, and that apparently the appearance of that is this muddy brown cast. So I think there's like a mud brown color around your tubules or whatever. Then of course again, Waterhouse-Friderichsen syndrome with adrenal insufficiency. I already mentioned those two. Liver failure, heart failure, and I think that is everything.